welcome everybody to another of our Care Uncut live streams. And this session, we're going to be talking about the year of the health and care worker. So you might be quite surprised at this one, but did you know that 2021, according to the World Health Organization, they are promoting the year of the health and care worker as this year? So we're halfway through the year, and I know I've spoken to a few people, they're not quite aware of this. So this is the time we're in, really testing times for this, particularly the sector. So we want to kind of advance this idea, see why the World Health Organization felt they needed to do this, and what exactly is it entailing, and what should member states, so countries who have signed up to this, should be doing, and what are the outcomes of it? What are we expecting at the end of 2021 for this particular year, which is honouring, which is hoping to support health and care workers who, of course, are at the forefront of the pandemic. And I must apologise, because I know this is probably one of the worst times to hold a live stream. I'm not particularly sporty, but I know that there's a little bit of a game going on between Wales and Turkey, is it? I don't know, but there is something going on because my whole household is watching it right now. So I know many of you will be watching this back later. So welcome if you are. So a few housekeeping things, of course, as usual, to get more people onto the stream, share, like, however you're watching us, whether it's YouTube or whether it's Facebook, or maybe you're having a look through our Twitter feed and you come across this video, feel free to comment as well. Let the conversation flow if you're watching it live. And of course, if you're not, there's no reason why you can't later on retweet with a comment and get people finding out what this whole year of the health and care worker is, and seeing how that they can encourage their organizations to support it. So please do get involved. And a few things I want to have as a reminder for you. I'm going to ask my lovely colleagues to pop some overlays on, and that's our vaccine Q&A. So we did that back in, we did that a while ago, but we also have done a follow-up one recently in May, and that's to do with the report that we did. So we actually looked into, a couple of months ago, vaccine hesitancy within the care sector again. And we did ask an extra question as to whether people in the sector working in social care, so that includes people who are nurses working in care homes, as well as social workers and other people in social care, whether they felt that vaccines should become mandatory, because there were rumblings at that point. And then, of course, we had the consultation. And now, of course, the press is leaking that that's actually going to become mandatory in the sector. So we looked at some of the statistics of how people are being taking up the vaccination in care homes and in the care sector. And we suggested some adjustments to that idea of making it mandatory, mainly because if you look at the statistics, taking out some of the outliers. So there's some local authorities which have particular issues with people taking up vaccinations. If you remove them, then you can actually see across the board there's quite a high take up, and it's in line with the SAGE recommendations for vaccination of people who work in social care and in care homes particularly, and people who live in care homes. So one of our suggestions or our recommendations is to look at a more targeted approach rather than a general piece of legislation which applies across the sector. But obviously there's people with different views out there, and also in our research we found that the majority of people in the sector, working in the sector, were in favour of mandatory vaccinations. So that's something to flag up. It wasn't a huge majority, it was 60% versus 40% who were against the idea. So we've gone through a bit more detail in our research. So anyway, it's there. You probably have heard about it before, but do have a look at it now that it's probably going to be our reality now. We're going to have more discussion around that in the future. And also, we're just going to move straight on to introduce who we'll be talking to shortly. So we are really excited to have Jim Campbell on, and we'll be talking to him about his involvement in the World Health Organization. Please, organization, please do make sure that you find out more about this, and not just look at this live stream, but also find out what it means. We'll put some links in the chat, and we'll try to explore it a little bit more. So without further ado, I'm going to introduce Jim into the live stream. Hello, Jim. Hi, how are you?
Hi, Sophie. Good evening to you from Geneva.
From Geneva. I was about to say, where are you in the world? But of course, you're in Geneva. And welcoming you to this live stream. And it is fantastic to welcome you, because this is something which I think is a fantastic initiative. But before we go into it too much, can you just give us a bit of an introduction into who you are and your involvement in promoting this initiative?
Thank you, Sophie. So yes, Jim Campbell. I'm the director of the Health Workforce Department in the headquarters of the World Health Organization in Geneva. And my team, a multinational team from all over the world, and joined by colleagues in over 140 offices around the world, are responsible to support 2021 as the International Year of Health and Care Workers. Geneva is in the news today because the President Biden and President Putin have been holding their summit here in Geneva in person. We've also just had the World Health Assembly, the annual event of our governing bodies. 197 member states come together to discuss the most pressing health issues of the day, to go through an agenda which ranges from all communicable diseases, the issues of aging and non-communicable, and of course, last year and this year, the whole issue of the COVID-19 pandemic. This year's assembly was virtual still. And of course, you may have seen over the last 18 months our regular press briefings, which the Director General, Dr. Tedros, hosts live from Geneva twice a week now, previously 3 times a week, which gives the latest update on the pandemic and what's going on in the world. So we've been a busy place, more in Geneva, busy today with the political focus, but with the COVID-19 pandemic very much the center of the evidence, trying to get that into the public domain.
Brilliant. And in thinking of how that came about, that assembly is that where the year of the health and care worker, that's where that's established, and presumably that was earlier in last year, in the middle of the pandemic, deciding that this year would be the year of the health and care worker.
Indeed, Sophie, because of the pandemic, our normal event is held in the May. And last year, clearly with the major first wave around the world, there was a short virtual gathering. And then a special session of the World Health Assembly was convened in November last year, particularly around the pandemic. And it was there that the Minister of Health from the Republic of Turkey, one of those football teams that you mentioned a moment ago playing this evening, Dr. Fahrettin Koca from Turkey, proposed that given the critical role of health and care workers at the forefront of the global response to the pandemic, that 2021 be especially designated as the International Year of Health and Care Workers. And this is the "and" here is very, very important. Obviously, a lot of people often refer to healthcare workers, healthcare being a single word, but this is health and care workers. And we do recognize the distinction between the economic sectors. We recognize the distinction in some of the occupations and the different types of services that they provide.
Really, really important, and we definitely appreciate that recognition. So I really want to kind of delve straight into what the goals are and expectations are of this this initiative. So we have some of the campaign objectives here, and it would be great to find out how they're going. Obviously, we're halfway through the year now. So ensure the world's health and care workers are prioritised for the COVID vaccine in the first 100 days of 2021. I know definitely over here that's something that we've been doing, and I'm sure that could be across the board. But I'll just run through these, and then maybe you could pick out a few to comment on. Recognising and commemorating health and care workers who have lost their lives during the pandemic. A very worthwhile thing to do, absolutely. I'm going to whiz across to the last one. Bring together communities, influencers, political and social support in solidarity, advocacy and care for health and care workers. And the middle two, I think, probably are a little bit more difficult in terms of how tangible getting out some real results from these are. And that's mobilising commitments from member states, international financing institutions, bilateral and philanthropic partners to protect and invest in health and care workers to accelerate the attainment of the SDGs and COVID-19 recovery. And breathe. And of course, then the last one is to engage member states and all relevant stakeholders in dialogue on a care compact to protect health and care workers' rights, decent work and practice environments. Now, I don't want to go through all of them because there's a lot in there. And I'm quite interested, especially in the long mouthy one. I think that's maybe where the tangible stuff, the meat on the bone, if we could get member states to do more of that, that would be incredible. So maybe from your point of view, how do you feel about those objectives, and how positive do you feel that you will be able to get member states to really prioritize that deep work in that objective of bringing the finance and everybody together to improve their policies?
We're actually, Sophie, you're right. We're halfway through the year almost, Jim, but we've just had our World Health Assembly, the 74th Assembly, where health workforce was one of the topics which was given greatest focus. There were the Director General, Dr. Tedros, in his opening remarks to the Assembly, spoke about the moral obligation, the duty of care that we owe to health and care workers around the world, that not only the managing the pandemic, but maintaining the provision of all healthcare services, the routine immunization programs, the care of the aged, especially when many of those have been unable to have family visits in long-term care institutions or visits in intensive care and hospital. So the role really given a hard focus. But two of the agenda items were on the role of the health and care workforce under the theme of the year, to protect, to invest, and to do that together. And indeed, one of the resolutions that was adopted by proposed, and this is the political consensus, an international political consensus of all the countries to endorse a resolution at the Assembly, was titled to protect, safeguard and invest in health and care workers. And again, the "and" is critical. We recognize that around the world, there are over 130 million health and care workers that are actively working. And there are some 60 million additional workers that are in unpaid care roles. And so this is one of the world's largest economic sectors of activity. In some of the high income OECD countries, this can be 1 in 8, 1 in 9 of all the jobs in the labor market. in terms of the health and care economy. So we recognize there's a huge body and that we need to do those three things. We need to protect, we need to safeguard, and we need to invest. And so that first mobilizing commitments, indeed, we say what we've got is the international political consensus from 197 ministers of health all around the world who've agreed a set of actions that they will undertake within each and every country. And they've additionally made recommendations to partners, that's partners in education, professional associations, unions, and to the international financing institutions, the multilateral development banks, the philanthropic groups, and how they can also invest in long-term sustainable financing of the education and employment of the workers that are needed to be responsive to population needs. So that is, as a global governance instrument in the World Health Assembly, we've seen that progress. The second thing they agreed with resounding support and not a single objection in the Assembly is to develop a global health and care worker compact. Now, this debate, your audience in the UK may be familiar with this debate. There have been questions in the Houses of Parliament on this topic to the government. Lord Crisp, the former director of the NHS, and the Permanent Secretary, put forward a question to the government asking would they be carrying forward the recommendations in the World Health Assembly on a care compact, and would they similarly look at whether or not it is time for a covenant or a compact similar to the Armed Forces Covenant in the UK, where we extend the duty of care principles to all health and care workers, especially when they may suffer infection or death through occupational hazard. An example of this, then, similarly in terms of what member states, President Macron, just across the channel in France, in his address to the Assembly and just before, has launched exactly that, an agreement with all his health and care workers that should they, as a result of their work during the pandemic, acquire an infection, acquire a long COVID impact upon their lives, or unfortunately pass away, then their families will be protected because they are in the service of the country. So there are movements, there are real movements in Europe, in the Houses of Parliament on this issue taking place today. And we hope in the next 6 months, we go from an expression of political consensus into the national actions at country level.
That is really inspirational and really positive to hear, especially making that comparison. I know not everyone's in favour of it, but I think it's useful between what people do in health and care and the army. So if you think about the benefits that people who might go and fight a war, they might come back and have certain supports for their family, and just thinking what might be needed for the care sector. That's I think that's really incredible. And just to clarify, what's the legal standing of what is a compact? What does that mean? And is there a particular legal standing, or is it more of an agreement, gentleman's agreement, if you like, between the member states?
Indeed, it's a good question. The compact is often used as, it is an instrument. It's a multilateral governance instrument. It's been used in recent times to agree the international political consensus on migration, an international political consensus on refugees, political consensus on the role of public and private sector in the SDGs. So there's a number of examples where it sets out the main principles, the main articles of areas where multi-sectoral, multi-jurisdictional political engagement can support an agreed set of principles and actions which have a greater good. And it is very much a sort of common good, a public health good. In this instance, that type of instrument has the potential to really reaffirm the principles of the duty of care. With the duty of care has long been very well understood. We have a duty of care to each other. We have a duty of care from an employer to an employee. We have a duty of care in terms of our behavior and some of our ensuring the prevention of discrimination. So how do we put those duty of care principles, which are very well recognized in international legal instruments? The International Labour Organization has a lot of the labor rights and privileges that exist. Healthcare and the ethics of healthcare have a number of other areas. So how do we bring all these different established principles and commitments and legal instruments together under a framework to say this is where there is a duty of care? And that would extend. The comparison to the armed forces, yes, is we use that as an example. It's not to compare the work, the functions, but there is a comparison to say, actually, we value these workers who are caring for us, who are protecting us. And they're protecting us from ill health. They're protecting us from food and safety standards and public health measures. And in valuing what their role, we also make a commitment that should anything happen to them in their service to health, in their service to care services, we will protect them.
Fantastic. It's really laid out sort of the vision of this initiative and also what the impact it can have. And I'm just thinking now that hopefully more people might be starting to get aware of it, what would we be expecting from our, whichever country you're in, but presumably the UK, what can we do to say, well, this is the year of the health and care worker, what should we be lobbying our decision makers to do to support this? And do you have any examples of success stories maybe in other states or maybe even here?
Well, indeed, I would welcome, please, all your audience that are actively involved in the Coproduce, in your webinar series, in your engagement with them. Use this as an opportunity to promote your advocacy. Not everyone follows what happens in the United Nations and the World Health Assembly, but this is actually in favor of your sector. This is overdue recognition of care workers, and a necessary change to recognize it. In the NHS, 1.3 million people, and that everyone quotes that figure as one of the world's largest employers anywhere. But the care sector in the UK, 1.65 million. You're a bigger sector than the NHS, but often overlooked. We have not overlooked you. We are saying that all the health and care workers in the UK, around the world, are part of this year, and they are part of the recognition, but also the action. So get engaged, use it. The language in the Assembly requires member states, in this case, the United Kingdom, the home nations, the 4 home nations, to take forward a series of actions. So urge them to do so, get involved with them, take the opportunity to get engaged. Where firstly, all health, you mentioned in your opening remarks about the evidence and the issues around the uptake of vaccination. Our message to the world is that all health and care workers should be prioritized for vaccination. They are in their roles that they perform. They have an increased level of occupational risk. That risk is continuously being reduced through good clinical practice, clinical protocols, through health and public safety measures around the world, better understanding of the pandemic and how to manage it. But nonetheless, there is still an elevated, heightened risk of infection, and let's remove that by giving them the option for the vaccine. So let's get that to all health and care workers around the world. We wanted all countries to have started that in the first 100 days of this year. We didn't quite get that far. We had 82 countries had started. So that's about 1/3 of the world. So there's still work to be done. Get engaged. You've seen that the conversations in Cornwall, just with the G7, that's been on your news channels, a commitment from the G7 and the UK to really support the vaccine equity around the world. Get engaged, promote that. It may not be the health and care worker around your corner, but it's the health and care worker in every other country that we need to support. We have to recognize and commemorate the deaths and put, we need more work. The Office of National Statistics in the United Kingdom has been very good at demonstrating the impact not only in the health and hospital facilities, but also in the care facilities. And that is valuable information because it helps us improve the clinical safety, the clinical protocols in aging facilities. Let's have more of it. Do put pressure on the Office of National Statistics. That data should be live. It should be available every month, not once every 6 months. We cannot make informed decisions if we don't have data in the public domain. And then, speak to your care industry, your care authority, your care provider. Are they aware, and how can you celebrate this? We just saw, even though we're halfway through the year, we just saw a couple of weeks ago in Ethiopia. And Ethiopia particularly challenged at this moment in time, but with the pandemic. But nonetheless, the minister's still driving this agenda, launching an engagement and signing agreements with the professional associations, with the nurses, with the doctors, with the unions to get engaged and take action. It would be wonderful to see something similar coming out of the UK.
Excellent. Thank you for that. And just while we've got you for a few more minutes, I can see if we could pull up the comment that we had from, I think, Louise, and she wanted to really see what you thought about what's been discussed in the UK at the moment around compulsory vaccination for care home staff, making that a provision of employment for any care provider that's employing staff, only to use staff who have had the vaccination, which we don't have that at the moment, but that's going to be touted to be enshrined in regulations. Obviously, the vaccination is something that you are promoting with this initiative. What are your views on making it mandatory for care workers?
The evidence that we've seen, Sophie, around all the vaccines and their approval for emergency use listing is that this is a tool to really help prevent infections and reduce the number. We've all seen around the world the continuing challenges, and when infections rage out of control, when this magic R number that the press and the media have been so focused on since March of last year, that when infections rage out of control, it puts a burden on our health and care systems, which means that mortality increases. So the evidence is fairly overwhelming that this is a tool to reduce infections and go through for that. The whole issue around mandatory, compulsory immunization is one for national authorities to take as they deem fit. What we are recommending is that all health and care workers are giving the opportunity to have that vaccine, and as health and care workers to really look and support the uptake of vaccination amongst the general public. If we apply all the health and public safety measures that we have at our disposal, and vaccines are one of the critical tools, we can reduce infections and reduce the risk to life. The evidence is overwhelming. But making that compulsory as against using education and engaging people in the uptake of it is an approach that will always be one that is under debate.
Okay, thank you. A very safe response. I couldn't push you either way, but no, that is fine, and it's helpful to discuss that and how it just generally vaccination is just a game changer. So yes, thank you very much for answering that. And we have come to time with you. There's so much more that we could have gone over. We had some other points in the background that we could have pointed out. I will just pop them up now, to be continued maybe. We found this report actually referenced in one of the Hughes documentation, I think, from the Assembly, maybe from last year, and that this is really kind of the title just is quite clear, screams at you: delivered by women, led by men, and the gender inequalities around that. That's definitely something I think we as an organization will revisit on a live stream, because it's an interesting one. And obviously the work that you're doing here to have the year of the health and care worker, it's really the year of the health and care worker, and particularly of women who work in that sector. So again, by supporting this initiative and pressing for our member states to kind of look into it and support the initiatives that you're trying to do, you're really supporting women in that sector as well. So all very much positive stuff. And maybe we could invite you back again a year later to see the progress and how it's gone, and whether the compact is being successful. So
Indeed, Sophie, and I'd ask you and all your people, we will be having an open consultation process on this Global Health and Care Workers Compact. I invite you and any other organization actively involved to submit your evidence to the World Health Organization in that open consultation, and help us create a compact that you believe will have the impact necessary in the UK.
Wonderful. All 4 consultations. That's really good. Thank you for that. And thank you very much, Jim, for joining us this evening. Take care.
Thank you, Sophie. Take care, and best of wishes.
Thank you. Okay, so that was really fantastic. I was so interested in finding out more about that. I found out more than I thought. I'd read it all, but that was really enlightening. And also the enthusiasm for really supporting health and care workers. So we definitely recommend sort of going on to the World Health Organization website and finding out more about it, and maybe pushing if you've got people in your local authority to support it, maybe to do something in some way to raise awareness, because thinking about how we can actually go forward and support our health and care workers is more important than you think, really. And this live stream has helped sort of reignite that idea in my mind, and hopefully has also in yours. And just really to close off and encourage people to follow us, and to click on, if you're on YouTube, subscribe, and to click on the bell, because we will be planning a live stream. It's in the works at the moment, to bring on some union representatives, so from some of the top unions, and maybe some other people as well, for some general discussion, and try to kind of unpick what belonging to a union means, which union you might want to join. Does it matter? I don't know. And then also we want to revisit that document about the gender nature of care. So we are going to be trying to get some speakers to take part in those discussions. And of course, if there is anything, thank you, Louise. Louise just saying that she enjoyed watching. But also, so if there's anything else that people want us to discuss, or any guests that they want us to invite, then please do get in touch. You can either message us on Twitter or email us, hi@coproducecare.com, and we will try and get that together as much as possible, because we just want to encourage debate around issues, not those that are just in the news around care, but also just generally anything that will support the sector and people who work in the sector, and people, of course, who use care services. So thank you all for listening in and watching us. Remember to share, and we hope you have a very good evening. Thank you.